Patients should consider sinus surgery when they've been treated with what we call maximal medical therapy, typically involving antibiotics and steroids, and yet they still have symptoms persisting. The common symptoms of sinusitis, whether it be chronic or recurrent acute, include facial pain and pressure, nasal obstruction, drainage either out the front or down the back of the throat from the nose. Sometimes this is discolored, sometimes not. Decreased sense of smell. Typical workup for sinusitis when some of those symptoms are present is that we certainly want to do a great history. We want to follow that with a very complete physical exam. Oftentimes that will include nasal endoscopy. We pass a little scope that's about the size of a piece of spaghetti in the nose just to visualize the anatomy on the inside, things that we can't see just from looking on the outside. And depending on what we see, if we do feel like you have sinusitis, you have true sinus disease, we want to treat patients with maximal medical therapy first before we consider sinus surgery. We're really there to try to keep patients out of the operating room. Ultimately, that's better for patients. It's not what we want to do. The reality is many of our patients will go on to require at least a discussion about the possibility of sinus surgery. But again, our goal is to try to keep patients out of the operating room. So when patients come in for a balloon sinuplasty, that's a procedure that we do right here in the office. We start by numbing patients up just topically using little pieces of cotton on the inside of the nose. We start to set things up with some very gentle numbing medication being injected into the mucous membrane. Interestingly, patients oftentimes don't feel that or very mild discomfort when that goes in. And after that, it really is just a matter of pressure that people will feel as the balloon is placed and then inflated. So the ultimate goal of doing balloon sinuplasty is to maximize what we call the outflow tracts, basically the pathways from the sinuses into the nasal cavity. Placing the balloon is a way to dilate those natural openings. We want to find the natural pathway and just make it a little bit bigger without removing tissue if we're able to do so. It's rare, but there are cases where the opening that we've made with a balloon is not adequate or will close. Those patients are candidates for either redilating or sometimes a more traditional procedure that's typically in the operating room but still uses minimally invasive techniques where we're using scopes on the inside of the nose, no incisions on the outside, and actually removing a small amount of mucous membrane lining and bone. When we think about who is a good candidate for this procedure, certainly first and foremost we want to establish that patients have true sinus disease and that we're not able to improve their symptoms significantly with medical therapy. Once we've established that a patient is a surgical candidate, we start to ask, well, is this patient someone we can take care of here in the office? Really, I don't consider there being any significant contraindications or reasons we absolutely wouldn't do the procedure in the office. You do have to have a patient that tolerates the scope, tolerates the exam well enough for us to be able to visualize things and get things numbed and comfortable for them. In terms of recovery time after balloon sinuplasty, the amount of time that patients are off of work or not able to resume activities is typically quite a bit less than a traditional sinus surgery. That being said, there are cases where even here in the office we do remove small amounts of tissue and we want patients to be more cautious about engaging in significant physical activity or blowing their nose. But in general, it's a day or two for most patients to really resume their normal activities.